Hi, I'm Dr. Mike Evans, and I'm going to tell you a story with three themes. I'm going to introduce you to two new terms and one new company. So let's begin with the three themes. This story is about your health, but it's also about money, and it's also about decisions. It's about considering how you self-care, but it's also considering the big picture. The goal is to bring you up to speed with the crossroads we are currently at in paying for healthcare, and then asking you where you want to go knowing this. If we look at the big picture of healthcare and how we pay for that, typically there are three payers: the government, the company you work for, and or you. So when we look at the cost of healthcare, medications or drugs are a key starting point. Medications are the fastest growing part of the healthcare budget. We spend more on medications than we do on doctors in Canada. According to a 2010 Kai study, almost $5 billion more. If we look at your insurance costs or employee benefit plan, that pays for things like prescriptions, physio, extra charges at the hospital, dentistry. Drugs account for approximately 70% of the cost, and this has been going up at a rate of 10% per year. Drug coverage, up until the last few years, has generally been an open checkbook. Unfortunately, this has led to skyrocketing costs, and I think it is important to remember that this extra payout doesn't just disappear. It has to cost in some way. It might mean less pay for you or less coverage for other things you care about, like glasses or physio or massage therapy. So I think we have to accept that there is no longer an open checkbook, and this creates a situation where we have to be much smarter. Now, they say every suitcase tells a story, and I suppose it is like a suitcase. You want to stuff everything in there, but you only have so much room, so you can bring all the right things, but you have to be thoughtful and make informed choices on what to bring. There is always a trade-off. So the question is, what are you going to pack in your own suitcase that is going to be the best for your health? So let's drill down on the medications. And this is where the two new terms come in. The first is formulary. A formulary is a list of medications that are paid for. This can be from your government, your hospital, your insurance company, and so on. Some drugs are covered and some are not. Drugs are covered when there's research that provides evidence that they are effective and safe. Drugs tend not to be covered when they are unsafe or if they are more expensive than drugs that are just as effective. This brings up the second new term, which is cost effectiveness. This is when we look at therapies and decide that drug A is as effective as drug B and is a lot cheaper. Or we might say, drug A is actually a lot more effective or maybe easier to tolerate than drug B. The question is, how much more are we willing to pay for that benefit? Basically, cost effectiveness is about drawing a line in the sand and saying to ourselves, like we do in our personal lives, we only have so much money. What is the best way to spend that money? As I've said, drug costs are escalating, but it also turns out we're spending money on drugs that really aren't any better than less expensive drugs. For example, in 2005, Dr. Steve Morgan and his colleagues, in a review in the British Medical Journal, estimated that 80% of the increase in the cost of drug plans in Canada were for what we call Me Too drugs. So Me Too drugs are really sort of newer, shinier drugs that are usually no better in clinically important ways. There are always a few significant advances for sure, but this is not the majority, and as a payer we have to separate the wheat from the chaff. So this is where the new company comes in. The new company is called Reformulary, and they are working with insurance providers to create a new type of formulary, one where money is going towards the drug treatments that are shown to be the most effective. They do this by bringing together a group of leading doctors and pharmacists who look at literally thousands of studies to decide which are the most effective drugs. What are the medications that represent a breakthrough that we should be paying extra for? And what are the ones we shouldn't be paying more for? What this means for you as a group is that your costs are lower and your premiums are going to the most effective treatments. But it also might mean some changes to how things work. One change is that you would be able to go to a section of the Reformulary website called My Reformulary and check out the Drug Finder. It's a kind of cool online tool that will show you where your medications line up. Think of the Reformulary as your plan's medicine cabinet, and the Drug Finder is your tool to help you choose the best value drug for your medicine cabinet, your top shelf meds. What do I mean by best value? Well, your top shelf drug works just as well as other similar drugs and is less expensive. In Drug Finder, you'll be able to see what you pay for your particular drug. In insurance terms, that's called a copay. So for the Reformulary top shelf drugs, the insurance company will cover the majority of the cost, and this means you pay less. You might just find out that the drug you're taking is not on the top shelf of Reformulary. It's likely more expensive and no better than other drugs that are out there. So you can either switch and pay less, or you can simply continue to take the drug you are on, but you'll have to pay more, what the insurance industry calls a high copay. Now, take a closer look at the top shelf drugs in Reformulary. What you'll find are brand name drugs and generic drugs. What's the difference? Well, brand drugs have a patent for a period of time. When the patent expires, companies make generic versions of the same drug. These generic versions are similarly effective and just as safe, and usually a lot cheaper than the brand name versions. Thanks to Reformulary, you have access to both brand and generic drugs. Why? Well, they've negotiated better prices and more options from the drug companies and are passing the savings on to you. Finally, Reformulary reviews the evidence to make sure drugs that have been found to have problems or are ineffective are flagged and removed in favor of safer options. So, hopefully this talk helps you see the big picture of cost effectiveness in formularies and how a new Canadian company, Reformulary, is making it easier for you to receive evidence-based care while lowering your drug costs. Take care, and thanks for listening.